Hello, I'm Dr. Kenneth Cusi. I'm the Chief of the Division of Endocrinology, Diabetes and Metabolism at the University of Florida at Gainesville in Northern Florida. It's a joy to share a few minutes with you discussing the importance of fatty liver disease for endocrinologists.
And I'm Roger Green. I'm the executive producer and host of the Surfing NASH Fatty Liver podcast. You may have heard of our first podcast, Surfing the NASH Tsunami. Ken and I would like to invite you today to join us for the first episode of our new series, The NASH Tsunami and Diabetes, Getting Ahead of the Rising Tide. In this new series, we will share the most recent research and perspectives on the relationship between type 2 diabetes and fatty liver disease. Ken will talk a little bit about his journey in endocrinology and why this is so important for us to be doing right now.
Thanks, Roger. This is really a journey that I had and that we all, as endocrinologists, will be going through. And the reason is that it's a real problem that we have in our clinics. About 20 years ago, I was approached by a gastroenterologist when I was working at the University of San Antonio, say, what do we do with people with diabetes or obesity with elevated liver enzymes? And as I started looking into this, this was an increasing problem. Well, in the last 2 decades, we've come a long way. And now we really understand that been what we thought was a benign finding in the liver and an ultrasound or any other study really has dire consequences. And that has led to guidelines for endocrinologists that we just presented at the American Association for Clinical Endocrinologists. Now, what has changed is that particularly in the recent years, we built the evidence to say that if you're seeing people with diabetes, particularly when we talk about diabetes, largely type 2 diabetes, one of every 5 or 6 of your patients has a degree of fibrosis in the liver that will put him or her on a path of cirrhosis. And today, the key thing for us as endocrinologists, first, think about it. You'll never diagnose what we don't think about. Second, know which are the simple tools that we have to identify those with scarring in the liver and do the appropriate test to send them to the hepatologist. And third, know that some interventions from weight loss by any means, some diabetes medications like GLP-1 receptor agonist or pioglitazone can help you. But Roger put together a panel that is fantastic, I think, not because of me, but because of our other guests. And Steve Harrison is a hepatologist that worked together in the first study with pioglitazone that we published 15 years ago. He has done a landmark study just published last year showing that in individuals that are completely unaware of having fatty liver and the doctors even more unaware of this, they were just undergoing a screening for colonoscopy. The rates of fatty liver and advanced fibrosis are staggering. So we'll hear about that. We also have Dr. Kay Pepin from Mayo Clinic who can educate us on how their gold standard technique that hepatologists use by magnetic resonance elastography can replace the need for liver biopsies in most of our people and tell you what is the future of that person with advanced fibrosis. And finally, a very important thing for us, we think we're very good at predicting heart disease based on the traditional risks, but Kathleen Corey from Boston is going to tell us that cardiovascular disease is very common with some really scary numbers. And just 3 weeks ago, the American Heart Association and the American College of Cardiology put out a review positioning fatty liver as a major risk factor for our patients. So a lot of information packed in a fun way. And Roger, it's always fun to try to get the best out of us. So
we have a simple rule, Ken. If nobody laughs, nobody listens. If some of it can't be enjoyable and engaging, then in fact people get bored and tune out, frankly. Everything you said is right, but I'm not sure people listening to us right now understand the scale at which that is true. So one of the things we've learned in San Antonio study that Ken mentioned is that if you're walking around on the streets of San Antonio today and you happen to get a colonoscopy through military college, there's about a 3 in 8 chance that you've got a fatty liver. There's about a 1 in 7 chance that you have some measurable fibrosis. And there's about a 1 in 15 or 16 chance that you have advanced fibrosis. With diabetics, those numbers increase dramatically. 55%, I think, was the number with some form of fatty liver disease. 37% with some level of fibrosis. And as Ken points out, fibrosis is a problem in its own right because it leads to cirrhosis and it can lead to, as a result, hepatocellular carcinoma and or need for transplant. But also it increases the risk of disease. Back at the beginning of the COVID epidemic, fatty liver disease was identified as an independent predictor of the severity of COVID infection among people who got sick. So there's a lot more to fatty liver than people realize. And Ken pointed out, and he presented, ACE has now come out with guidelines on this, and we want to make sure sure that people in the endocrinology community who care about diabetes are up to date on all this information and other things that are involved.
I want to say goodbye and invite you to hear the full episode and become familiar with terms like FIB4, elastography, and why weight loss is so important for the liver and the use of specific diabetes medications to manage these complex patients. So welcome to the podcast.
And if you would like a link to join us, please click below where it says click here, and you will fill out a form that will transport you directly to our first episode. If you want to make sure to get the first episode right when it happens, because you're such a geek for this stuff, click here and we'll make sure to let you know as soon as it comes out. Have a great day. As we say in our family, stay safe and surf on. See you on the podcast. Bye-bye now.